Hi there, everyone. It's Steve Murray here, and welcome to the Living Kindly podcast. I'm on my own today. My partner in crime, Warren, is down ill. So I thought I would uh, do an episode myself and continue this discussion. I think that we've been having for a little while now around messaging, labeling, languaging, and why it's so important, and particularly when it comes to the difference between sick care and healthcare, um, and why it's important to label things, call things what they are. So I'm going to use some slides today. Makes it easier to just maybe get the information across. But um, I think what's really important for us to understand is that, um, or should we must not forget that COVID-19 and the pandemic has really left us counting the cost of 30 years of chronic underprevention, funding of prevention in the entire global healthcare space. Uh, we saw that people that had comorbidities like obesity or even simply high blood glucose levels were significantly more um, susceptible to serious illness or death. So, this question also for me goes to employers and ask the questions, are you fit to work? And is your staff fit to work? Um, so the question I've asked, myself and people I work with is, this is an important question, which curve are we flattening? And there was very little good about the pandemic time, but it brought this term flattening the curve into the sort of day-to-day lexicon, I suppose, of the way so everyone understands the term flattening the curve. And this slide over here represents, I made it quite small on purpose. Um, and I'll kind of ask you the question, don't they look similar? I'm no artist, but it looks similar to me. One represents the curve of coronavirus cases, and the other represents the growth in diabetes. Um, you see, the difference is that COVID-19 happened in a matter of weeks and months, while the curve we are looking at with diabetes happened over years. And I suppose we're a little bit like the frog in hot water, and it's been slowly getting hotter, but we're just ignoring it because it's part and parcel of what's happening. So we ignore it. But the result is that today, 120,000 people will die today from conditions that are completely preventable, mostly treatable, and in a large number of cases reversible with lifestyle change. And the question I've asked people is to say, what would have happened? So what response would we have made as a society if 120,000 people were dying every day from COVID-19? And what lengths would we have gone to make sure that we did something about that? Well, today we sit with 120,000 people dying today, tomorrow, the next day, from diseases that are completely, they certainly shouldn't be dying from. So, onto something that, if you're if you're a group fitness instructor, if you're a personal trainer, if you're a biokineticist, a sports scientist, an exercise physiologist, um, a doctor that's done any um, sort of work in sports medicine, we've all seen this diagram. This is um, the infamous illness wellness continuum. And apart from the really obvious problems with it, which is that one way sort of goes to high level wellness and everlasting life, and the other goes to sort of premature death. And the other real problem is that it presumes that there's a neutral point in health where there's no discernible illness or wellness, which is just not true. It's like a bank account. It's either going up or it's going down. But it is valuable in some way if you look at it, because the one direction says, okay, we become aware of the right things to do, we become educated about the right things to do, we grow in our expertise and knowledge, and we work towards this high level wellness. On the other side, we start with signs, symptoms, it advances to disability and then potentially premature death. So this is the kind of question that I ask, is to say, well, what is sick care and what is healthcare? And what are the strategies that we currently use? So if we start to say, okay, who cares and who pays? And that term, who cares, who pays, um, was was asked of me by the CEO of Technology Med South Africa, Kevin Payne, in my opinion, one of the truly great, smartest guys in this industry. And he used to ask us all the time as a team now, who cares and who pays? And it's a really important question. So if you look at the illness wellness continuum and you go, let's start on the left hand side, which is really illness. So who cares? The employer. The employees care. If your staff are getting ill and are not there, it's a problem. Medical aid administrators care. Disability insurers care. Long-term insurers care, and they pay. They pay in some way. The providers on that side of the curve are your medical professionals and your allied medical professionals, and they get paid on this model of fee for service, which basically says, I'm the expert, I'm going to tell you what to do, and you pay me, regardless of outcome. If you look on the other side of the curve, the wellness side, who cares and who pays there? Well, you know what employers do sometimes, but not typically, and individuals pay. So people who are aware, they will take care of, they will make sure that they pay to manage their health. So who are the providers on the wellness side? Well, your personal trainers are there, wellness practitioners, sports clubs, sports coaches, and they use a model which is fee for membership or fee for access. And both of these, by the way, suffer with the same challenge. There's no accountability to providers on either side. Fee for service means that it doesn't matter if you get better or you don't get better. It doesn't matter. I get paid regardless. Fee for membership, health clubs work that way. Whether you go or don't go, whether you use the facilities or don't go, they collect the membership. And in many cases, they work on the basis that they know about 30% of members will actually use the facility, so they can sell a lot more memberships than the club could physically take. So the challenge here is that by the way, just if we look at the stakeholders on each side, and this is interesting. Your stakeholders on the illness side, hospitals, big pharma, and your managed care companies, those are the stakeholders. Those are the people that have got real skin in the game. On the healthcare side, your stakeholders, your gyms, health clubs, your supplement industry, your loyalty programs, sports clubs, those are your kind of stakeholders. And so now we look and say, okay, each of these are pretty much working independently of each other. Let's have a look how we've done. So if you look at the healthcare side of the program, let's look at our scorecard. Well, this would be a fail in any environment, because the bottom line is, if we just look at activity, only 32% of adult women reach their aerobic requirements that the World Health Organization sets. 21% for strength on the male side, 39% aerobic, and 32% for strength. That's a fail. We're certainly not going to move the needle that way. And we know already, that the sick industry at the moment, chronic disease is the biggest cause of death in the world. It's responsible for more than 70% of deaths. So if we ask, well, why did the sick care strategy fail? Why is that fail? And there's just a few of these here. First of all, medical professionals are not trained, paid, nor managed to deliver healthcare. So a doctor is trained, paid, and managed to manage someone who is sick, not necessarily to manage them to get healthy. Fee-for-service funding models I've spoken about already that are used to pay health professionals, they can't work for prevention. There's no shared accountability there. There's no shared accountability for outcomes. It's simply, I'm the expert, I get paid. Simple. And then, when we look at sort of rewards programs, we try and say, can we manage behavior? And we apply the same rewards based on this behavioral economics model. You can't use the same model for people who are at risk or with disease that you do for healthy people. Someone with heart disease is not going to necessarily want a smoothie for, reaching an amount of exercise in a week. Um, and healthcare professionals engage with patients less than 5 times a year on average, which if you take 15 minutes per appointment, it's 1.5 hours per year. But chronic disease, that just marches on. So the sick care strategy has failed. Now, on the healthcare side, why is that failing? Well, rewards programs, that are there. The funny thing about rewards programs, you've always seen this, whether they be medical aid based or whatever, they're rewarding people that are already active anyway. And medical scheme created programs, somebody has to pay for them, and they ultimately push medical insurance rates up, medical aid rates up. But the people who are using the rewards would have been active anyway, regardless of whether the reward's there or not. Fee for access models that are used to drive, and both rewards and fitness facilities. They can't change behavior, as again, there's no shared accountability, for the outcomes of the person or the participant. And the thing that I think is really important is that the health and fitness industry have significant capacity, both in bricks and mortar and skills. But they've been excluded, from the public health narrative, both in the private and public sector. There are so many really good corporate-based fitness centers and providers, but they're not part of the discussion around fitness or wellness. So, for me, it's really important to understand the difference between sick care and healthcare. And if you're an individual or a company, understand uh, where do you need to spend your money? Where should you be spending your money? And I'm still of the opinion that medical aid or medical insurance is treated as an all-encompassing kind of pool of money that people believe are responsible for both sides of this continuum. And as I said in the last episode when we were talking about this, we hear this in clinical practice day in, day out. Patients complaining about medical aid. Too expensive, it gives you less value. Well, absolutely. Medical aids are designed to fund sickness, not to pay for prevention, not to pay for your health club membership ultimately. Certainly maybe not to pay for your health coaching program, or not to pay for loads of exercise-based rehab, for example. There just isn't that funding. We cannot take medical aids and blame them for both sides of the continuum. At some point, we need to take responsibility for our health and understand that healthcare costs money. And spending money in the right ways and spending money in the right places is important. That good supplementation, for example, is healthcare. Your personal trainer is healthcare. Your health coach is healthcare. Your functional medicine practitioner is healthcare. and that you're probably already spending a load of healthcare money in your sick care fund. So choosing the right medical aid or the medical aid plan for you is important, because I understand that funding both becomes onerous. So if you're trying to use your medical aid as a healthcare provider, and then a real healthcare provider say, oh, this is what your program is going to cost, or this is what your participation in this program will cost, then it becomes almost a double stack. So being clear as to, if you look after yourself and you take care of your health and you participate in healthcare programs, real healthcare programs, there has to be a trade-off and a benefit for you on the other side of continuum. So I think the languaging is important. Sick and healthcare are different. Healthcare is the one that's going to keep you from falling down the cliff to the ambulance at the bottom, which is the right analogy for what medical aid really is. Medical aid is simply the ambulance at the bottom of the cliff when you have already fallen off. The secret is to avoid the cliff. And that's really your healthcare journey. So yeah, that's what I wanted to sort of get through today, and I'd love to hear comments from people who may be in the industry, whether it be on the healthcare side or the sick care side, and let me know what you think. And I'd love to pick up that conversation. So have a great day, everybody, and we'll be hopefully Warren will be back with us next week, and we can continue our discussions. Take care.